Home collected samples, the future of diagnostics. Imagine managing health monitoring from the comfort of home. No waiting rooms, no scheduling hassles, no uncomfortable conversations. As healthcare becomes more patient-centered, home-collected samples are emerging as a transformative solution. From routine health screenings to advanced diagnostics, this approach is streamlining how care is accessed. Home sampling empowers healthcare organizations to enhance patient engagement, improve outcomes, and reduce barriers to care. Whether it's self-collected blood samples for cholesterol monitoring, saliva for genetic insights, or swabs for wellness screenings, home collection allows providers to extend diagnostic capabilities beyond the clinic setting. While the benefits for patients are clear, the true value lies in how healthcare providers and diagnostic innovators adopt these technologies. At Nexus Medical Labs, we work with healthcare brands to seamlessly integrate home sampling into their workflows, ensuring accuracy, scalability, and operational efficiency. Why home collection matters. Traditional sample collection often involves multiple steps: scheduling an appointment, traveling to a clinic, waiting for your turn, and undergoing a potentially uncomfortable process. For many, this complexity leads to missed tests, delayed diagnoses, and poorer health outcomes. Home-collected samples aim to reduce these barriers. A study highlights how home-based microsampling technologies offer several advantages over traditional plasma or serum samples and are foreseen to play a central role in future healthcare. Key advantages of home-collected samples. 1. Convenience and time saving. Home sampling removes the need for travel, long wait times, and disruptions to daily life. Patients can collect samples at home whenever it's convenient, simplifying health monitoring for those with busy schedules, limited mobility, or remote locations. A 2021 study published in Therapeutic Drug Monitoring found that home sampling shortened time to diagnosis by nearly 30% compared to traditional clinic-based collection. 2. Privacy and comfort health concerns can be deeply personal, and many individuals avoid testing due to embarrassment or stigma. Home sampling provides a discreet, judgment-free option. A 2016 study by Ahmed Little et al. Found that home sampling kits for HIV testing significantly increased participation among those aged 18 to 30, a group historically underrepresented in screening efforts. 3. Cost effectiveness. Traditional diagnostics can be expensive, with costs associated not just with the test itself, but also with travel, administrative fees, and time off work. Home sampling reduces these expenses by eliminating the need for in-person appointments. A 2023 report by Liao et al. Found that healthcare systems incorporating home-based sampling for routine diagnostics saved up to 25% per patient annually. 4. Increased accessibility access. Access to healthcare is often determined by geography and socioeconomic status. Home sampling can help bridge these gaps, reaching rural, underserved, and remote populations. The World Health Organization emphasized home testing as a critical tool for increasing health equity, particularly for chronic disease management and wellness screenings. 5. High accuracy and reliability concerns about the accuracy of home-collected samples are understandable, but modern sampling technologies have addressed these issues. Techniques like volumetric absorptive microsampling and dried blood spots deliver results comparable to traditional venipuncture. A study by Delahaye et al. Found that home-collected dried blood spot samples for therapeutic drug monitoring were 99.5 concordant with venous blood samples, with no clinically significant differences. Debunking common myths about home-collected samples. While home-collected samples are transforming healthcare, some misconceptions remain. Let's address the most common concerns. Myth number 1. Home-sampled tests aren't as accurate as lab-collected ones. Reality. Advances in home sampling technology have closed the accuracy gap. Innovation like VAMS and DBS ensure precise sample collection without professional assistance. A 2021 study by Delahaye et al. Found that 99.5% of home-collected dried blood spot samples produced results consistent with traditionally collected venous samples. Myth number 2. Patients will make mistakes during sample collection. Reality. Modern home collection kits minimize user error with pre-measured devices, color indicators, and digital guidance. A 2020 study by Harahap et al. Found that 96% of participants collected accurate samples when provided with clear instructions. Myth number 3. Traditional labs offer faster turnaround times. Reality. Home sampling logistics networks and automated lab processing now rival and often surpass traditional testing turnaround times. With overnight shipping and streamlined laboratory integration, home-based testing ensures faster access to critical healthcare data, improving early detection and treatment outcomes. A 2023 study by Brunderick et al. Found that home-sampled STI tests had an average turnaround time of 72 hours, whereas traditional clinic-based testing often faced delays exceeding a week due to appointment wait times and lab backlogs. Myth number 4. Home testing lacks professional oversight. Reality. Home testing doesn't eliminate oversight, it shifts it to a remote setting. Many services provide pre-test consultations, post-test counseling, and automated alerts for abnormal results. A 2022 study by Vega Crespo et al. Found that 98% of patients who tested positive in home HPV screenings received professional follow-up care. Myth number 5. Traditional testing is more reliable for complex diagnoses. Reality. While some complex diagnostics still require in-clinic procedures, many high-complexity tests, including genetic and cancer screenings, are now validated for home collection. Studies confirm home-collected samples are effective for detecting biomarkers in chronic disease, pharmacogenetics, and infectious diseases. Nexus's role: enabling home sampling for healthcare providers. While home-collected samples offer clear advantages, integrating them into existing healthcare workflows can be complex. Nexus Medical Labs simplifies this process, partnering with healthcare providers to enable seamless adoption of home sampling solutions. We collaborate with health systems, telemedicine providers, and diagnostic innovators to facilitate self-collection workflows while maintaining CLIA-certified lab standards, support R&D teams in exploring how existing assays can transition to home-collected formats, provide logistics, processing, and reporting infrastructure to scale home sampling programs. Our goal is to empower healthcare brands to innovate while ensuring accuracy, compliance, and efficiency. Real-world applications. From STI testing to chronic disease monitoring, home-collected samples are transforming multiple areas of healthcare. Number 1, STI screening. Self-sampling increases testing rates by up to 32% among young adults, particularly those aged 18 to 24 who cite privacy and convenience as primary motivators. Number 2, chronic disease monitoring. Home-based HbA1c testing improves adherence by 45% and enhances diabetes management. Number 3, cancer screening. At-home HPV testing increases cervical cancer screening adherence by 3 times compared to clinic-based Pap tests. Number 4, genetic and preventive testing. Saliva-based genetic testing now offers accuracy comparable to blood-based DNA tests. The future of healthcare: patient-centric, efficient, and inclusive. As healthcare shifts towards personalized, patient-centered models, home sampling is expected to play a key role in prevention, early diagnosis, and chronic disease management. A 2023 study by Diagnostics et al. Projects that at least 50% of routine diagnostic testing will transition to home-based collection by 2030, driven by digital health advancements and increased consumer demand for convenience and accessibility. With advancements in sampling technology, logistics, and digital health platforms, home-collected samples have moved beyond convenience. They're becoming an essential part of modern healthcare. Healthcare brands adopting these innovations are not just enhancing patient experiences, but also future-proofing their diagnostic capabilities. The rise of home-collected samples represents a fundamental shift in healthcare delivery, offering benefits for patients, providers, and diagnostic innovators alike. As the industry evolves, Nexus Medical Labs remains committed to supporting healthcare brands with the infrastructure, expertise, and insights needed to navigate this transformation. Want to explore how home sampling innovations are shaping the future of healthcare delivery? Schedule a call with Nexus to discuss industry trends and how organizations are approaching patient-centered diagnostics.